in my rearview mirror and realized I was dealing with a droopy facial muscle. If you see me when I grin, the lower part of my face on my right hand side is actually lower than the other side, and it was different. And my first thought is this is not good because this is an indication or a warning sign, possibly of a stroke. I did not have a stroke. I immediately contacted my doctor, explained the conditions, the symptoms I was seeing, and he said it sounds like Bell's palsy, but you have to rule out a stroke. I contacted my fiance. She took me to Buffalo General, the Gates Vascular Institute. We went to the emergency room. They immediately took me in. The attending doctors said it appears to be Bell's palsy based on your symptoms, but we cannot rule out a stroke because these are some of the signs that you often see with a stroke, which is a droopiness on one side of your face, a slurring of words. You may have heard I'm not talking, probably enunciating exactly as I have because I'm still dealing with some muscle issues on the side because of a paralysis of a nerve that is associated with Bell's palsy. But they did the full testing to determine whether or not I had a stroke. They did the physical tests. They asked me questions. There was a whole team around me. And then they did a CT scan and an MRI. Very pleased to say I can guarantee that I do not have a stroke. And my political opponents may disagree, but I now have definitive proof from the team at Kaleida that not only have a brain, but it's in perfect condition. But I have Bell's palsy, which actually is an inflammation of the nerve that runs on the outside of the face, or outside of the skull, along your face. And it impacts your eye, it impacts your nasal cavities, it impacts your muscles on the side of your face, it impacts the lines on the top of your face, and it impacts your mouth. It is not bad, it's a minor case, but it could have been much worse. I could have had a stroke. And because the symptoms are very similar, you have to check it out. You have to immediately react. I want to thank the team at Buffalo General and Kaleida, Dr. Elot Levy and his team there at the Stroke Center. They have incredible treatments. They have an incredible team. Dr. Levy wasn't there, but his team was there. And they gave me the same type of service they would give anybody that they're questioning whether or not they have a stroke. And I want to thank them for what they did. Bell's palsy is a nerve issue. It's an inflammation of the nerve, which can actually then cause paralysis of the nerve, and it affects the muscles and the other aspects that the nerve has, as I've learned. This is something that a family member of mine has had in the past. I've known other people who've had it in the past. It can last for weeks, it can last for a few months, and then it can usually disappear. I'm on some medications right now to help reduce the inflammation, and it is actually better today than it was on Saturday, better than it was on Sunday. But I wanted to bring this out because I think the public needs to understand, especially men that are my age, middle age. We often have things and we're like, I'm not going to worry about it, or I'll deal with it tomorrow. But if you're having a stroke, there might not be a tomorrow. You could die, or you could have permanent paralysis. So I think it's very important for the public, especially men, to understand when you're going through something like that, you have to react. You can't just sit there and say, I'll worry about it later, or I'm not even going to worry about it at all, because it may be the last thing you ever worry about because you might die. Or you may end up with having a permanent injury that you really regret that you didn't take action. So I was very pleased that I take action. I want to thank my doctor, Howard Sperry, who actually came out of a performance that he was in to respond, especially when he saw a picture that I sent of myself at that point. He thought it was Bell's palsy based on my symptoms, but he said, go to Gates, get to the hospital to make certain that it is not a stroke. So I want to thank my doctor, Howard Sperry. As I said, I want to thank Dr. Elot Levy and the team there, and specifically thank Chief Medical Officer Michael Mineo and the entire team from Kaleida for the work that they did to ensure that I was not suffering a stroke, that it was Bell's palsy, and that I was released later that evening to go back home, whereas if it was a stroke, I probably might still be in the hospital. So I just want to put on, if you see me and you're wondering, why does he look a little different maybe than normal? Or if you hear me maybe slur a word, I got Bell's palsy. I may have it for weeks, I may have it for a few months, but it is not permanent in most situations. It does not have any effect on my brain. It is a nerve muscle that runs, or a nerve that runs through the front of my face. And I just want people to understand that I'm dealing with something that millions of other people have had to deal with. And it is not a stroke. It is not something that's affecting my brain function or anything like that. So I just wanted the public to understand it, but also to use this as a learning experience for if others are in a similar situation and you start to notice drooping of the face, if you start to notice issues on the side of your body, you need to react. And I'll turn it over to the doctors to talk a lot more about that, because it might be something a heck of a lot more serious than Bell's palsy. So I'll turn it over to our health commissioner, Dr. Gail Burstein, to talk a little bit, and then to introduce Dr. Mineo. So Dr. Burstein.
Thank you. Thank you. So as the county executive mentioned, if you feel a weakness on the side of your face or the side of your body, so your arm or your legs, isolated weakness can be a sign of a stroke. A stroke can be deadly. So it's really important that you get yourself to a hospital, a center that specializes in stroke. So we're very fortunate. We have some great facilities here in Erie County, but it's really important people get evaluated. So we're the county executive is very lucky that the type of palsy that he has a really good prognosis. So Bell's palsy, for people who are not treated, there's about full recovery in about a year by 70%. With early treatment, as high as 80 to 85% of people fully recover within a year. So you never know. You don't know what you don't know. So if you see anything weird happening with your body, any type of weakness, that can be a sign of a stroke. That is a medical emergency. Get to a hospital. Either call 911 or get somebody to drive you. This is an emergency. You have to take it seriously. So I'm going to turn it over to Mike, who knows much more about this than I.
All right, thank you, Dr. Bernstein. This is a great opportunity to educate the public on the signs and symptoms of a stroke. We want everybody to remember the acronym B FAST. B means look for signs of change in balance. I, change in eyes. F, facial droop. A, arm weakness or numbness. S, slurred speech. T, time to act. You lose 2 million neurons every minute of a stroke that you don't act. If you have signs or symptoms of a stroke, call your doctor, call 911, get to the hospital, get to Gates. We're fortunate that the county executive is doing better, but you never know. It's a hard diagnosis even for a doctor to make. You have to get to the hospital. Thank you.
Thank you, Dr. Mineo. Thank you, Dr. Mineo. Once again, thank you to your team. They did a tremendous job, as they would with anyone who gets to the hospital, goes to the hospital in that situation. He didn't mention it, but one of the reasons we often talk about go to Gates is they have 24-hour MRI. Not every hospital, especially in the outer regions in this area, has the availability for a 24-hour MRI. And it's that MRI that can determine whether or not you've had a stroke or not. So I think it's important, if you are in the immediate Buffalo area, we have some great hospitals here, including ECMC. They have 24-hour MRI as our level 1 trauma center, but not every hospital does. But the most important thing is if you can't get to a hospital, call 911, make certain that you react appropriately, because it might be Bell's palsy, which is in the grand scheme of things, something minor, or it could be something much worse. And we don't want to see people who could be saved be lost because they didn't react in time. With that, I'll open up to any questions from the media. Are there any?
That must have been terrifying.
The question was, that must have been terrifying. It was like, what's going on? And my eye was watering too. It just didn't stop watering. I thought it was originally an allergy issue. I didn't realize because the other items. But when I tried to put a slider in my mouth and realized it didn't feel like I can open my mouth as wide, and it was because this side was drooping, I knew something was not right. But no one else really noticed anything. And then I got to my car and I'm like, oh, this isn't good. So I immediately then called my fiance, reached out to my doctor, knew I had to react because it could be something much more serious. I explained all the symptoms that I was having to my doctor. He said, it sounds like it based on what you're seeing, and I sent him pictures. So it sounds like it's probably Bell's palsy, but you got to get to the hospital to rule out a stroke. Because he was said, and I talked to Dr. Mineo earlier, the last thing you want to do is say it's Bell's palsy, have someone leave, and then it'd be a stroke. As I said, some of my families had Bell's palsy before, so I was familiar with it. I've known other people to have it, and it can take some time to clear up, but I'm glad it's that and not the alternative.
Do you recommend taking yourself to the hospital or getting someone to drive you if you don't call 911 if you're family?
I mean, alternative, yeah, really, if you got no other way to get there. But one of the concerns was if my fiance was able to take me right away. It's probably better to have someone take you, but it's much better to probably have medical personnel. But I'll leave it to the medical profession to answer that one. Maybe I didn't handle it appropriately.
So
I'm not trying to put you on the spot or anything.
I think if you have multiple symptoms, specifically if it's beyond just the face, such as the slurred speech, the arm droop, call 911. Seconds matter. And they know which hospital to take you to.
Yeah, and that's something I did not have. I had no issues with the rest of my body. I really had no slurred speech at that point. I've noticed I don't slur my speech unless I really start talking very fast and stuff. Then kind of a lisp may develop because of what I'm dealing with the muscles and the upper lip, but not so much slurred speech is more of a lisp. I'm working. I was on a full day yesterday. I'll be working as normal because it's not really affecting anything other than what you might see or hear from my voice. But at that time, it was something's not right, and I got to have this looked at. And heck, I'm a middle-aged male. Our first reaction is, it's nothing. But you can't have that reaction because it's like, this isn't normal. And when it's not normal, you got to react.
Do you know what causes Bell's palsy? Is there like a direct cause, or is it still something that's being figured out?
There's a lot of different causes. We usually don't find the cause. Sometimes it's trauma. Sometimes it's tumors. Sometimes it's a virus. Lately, we've been seeing a lot of it due to Lyme disease.
Yeah, I will note they have me actually on antivirals in case I have a viral infection. And they did do a Lyme disease test, a blood test. I have not gotten the results yet. I have no reason to believe I have Lyme disease. I don't believe I was bit by a tick, but you never know. A couple of weeks ago, I was in the Adirondacks. People know I like to golf. It's not uncommon to have a tick on a golf course. So I'm waiting for the results of the blood test to see maybe if I did have Lyme disease. But I am on antivirals too in case I had a viral infection that I was unaware of that maybe caused it. As has been explained to me, it's basically an inflammation of the nerve, and when it touches the skull, it actually can cause paralysis in the nerve. And when it causes paralysis in a nerve, it affects everything that nerve addresses, which is basically the side of the face. And I don't know if you want to say a little more.
I think that's accurate. It affects the nerve on the outside, and the way you can really distinguish it from a stroke is it also involves the forehead. So if you see forehead and the whole face drooping, it's the inflamed nerve.
This is something that can happen to anyone. We got some middle-aged male, active, golfing, goes to the Adirondacks, hiking, all that, and he still has it.
It can affect all age groups. It's really rare in young people, but it can affect anybody.
Okay. Thank you, everyone. Just one brief update. We announced yesterday we're holding 3 COVID-19 vaccine clinics. Since we announced that, we've had great response with regards to appointments scheduled. There's a very good chance we'll actually be scheduling more vaccine clinics, especially for youth. We've seen great response for youth. So we've announced the first 3. The first one's almost fully booked. The other 2 are moving along very well. So based on that, do not be surprised if we actually schedule more COVID-19 vaccine clinics in the future. One of the reasons we're doing this is because pharmacies are able to provide COVID-19 vaccine. However, we've lost approximately half our pharmacies in the last few months with the closures of the Rite Aids. So we know they're not easy to get, and we are offering COVID-19 vaccine to all adults and those children 6 months and older, but they have to have their parental or guardian approval. And we fully expect that we're going to basically fill up all of our vaccine clinics. So do not be surprised if we actually schedule more in the future.
Can I say something?
Yeah, of course.
Yeah, so thank you, County Executive. So we are offering some COVID-19 vaccine clinics So far, we have 3 listed to schedule. Those are filling up. They may be filled up right now. We will open more throughout Erie County. So if you don't see one right now that's convenient for you, there will be one soon. Just want to say for parents of young children, I know many pediatric offices currently can't really offer a COVID-19 vaccine, not because they don't want to, just because the Centers for Disease Control and Prevention has not made the vaccine for children's program COVID-19 vaccine available to order. So pediatricians' offices are not able to order the COVID-19 vaccine for their patients. So we're going to be still going ahead and order the commercial supply, and we will offer this to anybody regardless of insurance. So parents, watch out for our postings. We're already kind of sold out for the current doses that we've ordered, but we are ordering more. So we want to make sure that everybody in Erie County who wants a COVID vaccine, regardless of their past medical histories, whether they have conditions that would make them at risk, or they don't, or they live with somebody that could get really sick, or they just want to stay healthy themselves, we want to make sure that everybody has access to COVID-19 vaccine in Western New York. So please, keep an eye on the Erie County website, and there should be a COVID-19 vaccine clinic opening up near you. Thank you.
Thank you all, everyone. Have a great day.